Well, it's pretty confusing out there. Imagine I just dropped you off in the middle of a very, very, very busy airport in the middle of nowhere, and you don't speak the language, and you're just there by yourself. It's confusing. It's overwhelming. You don't know what to do. You don't know who to ask, what to ask, and you don't know how to even communicate, and you could be completely lost. And that could really make you very overwhelmed. Now, this is exactly how healthcare is for people who are not entrenched in healthcare. People are not really working in hospitals all the time. They're just not, this is a very foreign environment to a lot of people. Then think of cancer. It is the most overwhelming thing a person could go through. No matter what, it's life-threatening. Because yes, we cure a lot of it, but we don't cure all of it. So there are people who don't get cured, unfortunately. And when somebody is affected with cancer, it is probably one of the most vulnerable times in their lives, no matter how powerful they are. And I know, Samira, you know this more than a lot of people. It's very overwhelming, psychologically, mentally, physically, everything. So with that, people then have to make decisions that are very, very important. Do I do surgery or not? Do I do chemotherapy or not? Do I do radiation or not? I mean, there's so many decisions they have to make. So I think despite the wealth of information that we have out there, despite all of the data that we have, despite all of the search engines that we have, when it comes to it, people, when they are affected with their health, and especially cancer, are overwhelmed, they're scared, they're concerned, and they want guidance. And I wanted to provide that guidance to people that don't know me, that I can reach to. And I thought the best way to do that is by writing a book called The Cancer Journey, which is really a simplified book. It's written in a simple language, easy language. I leverage storytelling, lots of the stories of people I have cared for over the years. And my goal was for anybody that reads the book, whether it's a patient, a family, a caregiver, a primary care doctor, a nurse, whoever it is, they have better understanding of what cancer is. They have more appreciation to the journey that patients go through cancer, and hopefully they're able to be a resource to these people. So I think more than ever, we need that guide. We need that guidance because things are very messy out there. Separating signal from noise is very important. And I think we need to help people when they're dealing with this disease.
This podcast, show notes, and newsletter is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or any materials linked from this blog is at the user's own risk. The opinions of the speakers are their own and do not represent the opinions of organizations they're affiliated with, nor do they reflect the opinions of Mantacares Inc. or Mantacares' sponsors.